Breast milk provides the real and ideal nutrition for all infants. It has a nearly perfect mix of vitamins, proteins, and fats, everything your baby needs to grow. And it is all provided in a form more easily digested than infant formula. Breast milk contains antibodies that helps your baby fight off viruses and bacteria and stay healthy. Breastfeeding lowers your baby's risk of having different kinds of ailments and diseases like asthma, type 2 and type 1 diabetes, allergies, ophthalmological issues. Plus, the babies who are breastfed exclusively for at least first 6 months without any formula have fewer ear infections, respiratory illnesses, and bouts of diarrhea. So breastfeeding is actually should be promoted among all mothers, and that is why we at Medicircle are having a media campaign on the breast feeding awareness week, and we are celebrating it along with all the doctors, especially pediatricians and obs and gynec doctors, just to know that whether our babies are getting enough mother's milk or not. So today, hi, I'm Smita Kumar and you're watching Medicircle. Today in this initiative, we are going to speak to Dr. Aditi Shah. Dr. Aditi Shah is the director at Small Wonders Children's Clinic and she has an experience of 13 years. She's also attached to Nanavati Super Speciality Hospital. And as her experience says that she has been speaking to so many parents, concerned mothers especially, and so I think she can definitely give her right advice today to so many breastfeeding mothers. She has also done multiple guidance lectures for parents, especially to help them how to take care of their babies in the best possible way, especially during their initial years. Hello, Dr. Aditi. Welcome to Medicircle.
Thank you very much.
Dr. Aditi would like to know, like, what should be the feeding frequency of babies?
So first of all, thank you very much, Medicircle. This is a topic which really needs a lot of encouragement. We know that breastfeeding is a natural process. God has given the gift to mothers as well as to children that even if there is no training, the mother will still be able to breastfeed and the child will still be able to breastfeed whenever required. But why do you need this encouragement? Naturally, because the mother is going through a lot of changes. She has just delivered a newborn baby. She's not really very aware of the right things and the wrong things that are needed to be done. The baby is also adjusting to a whole new environment, a new world outside. And with both of these new things happening at the same time, if the mother gets any form of encouragement from her doctor, from social media, or from her relatives, she will just be even in a better position to give breast milk to her mother, to the baby, which is the most required thing for the baby. The baby needs only breast milk. So that's what the mother has to do in the right way. Now, coming to your question, what is the feeding frequency? So as soon as the baby is born, within half an hour, if it is a normal delivery, the baby is put to mother's breast. If it is a cesarean section, sometimes you have to wait a little longer till the mother is a little more comfortable. And then initiation of breastfeeding has to be done as soon as possible. Once the baby starts breastfeeding, most often it is the baby who decides when he needs to take the next breastfeed. So it's more what we call as on-demand breastfeeding. So most of the times it is at an interval of 2 hours, but of course it's never mathematics with children, and therefore the mother can follow on-demand breastfeeding, which means whenever a baby wakes up crying, and the mother knows that it is mostly for hunger or for thirst, then she has to latch the baby to her breast so that she can give her breast milk. We generally ask mothers to keep a gap of 2 to 3 hours between two feeds and not to feed for longer than around 45 minutes during each feed. If you calculate that, then it comes to about 6 to 8 feeds in 24 hours. This is true for all babies till the first 6 months, but it's always independent and individual for every baby. So some baby may feed every 2 hours, some baby may feed every 3 hours, and that's why we always encourage on-demand feed. How will the mother know if her breastfeed is adequate if she's not following a correct schedule? That is by looking at the baby's urine output. If the baby is passing urine 6 to 8 times in 24 hours, that means the mother's milk is enough. The other way that a pediatrician looks at whether mother's milk is enough or not is by looking at the weight gain. So we have to make sure that the babies are being checked at regular intervals. Then only it is possible to know for sure that the mother is feeding the right amount and in the right frequency that the baby needs. if the weight gain is adequate.
Dr. Aditi, as times are changing, there are so many working mothers who are actually, again, they want to breastfeed their child also. But sometimes what happens when they are going back to work or when they are joining back their work, so there is a feeling that how would they now breastfeeding their child? And sometimes there are longer gaps. Now, many are actually working from home. That's a boon that they are still at home. But what should be advised to such mothers who are actually going trying to go back to work and at the same time they also want to feed their babies?
So this is actually an increasingly common question asked to us. It's only decreased in the last 1.5 years since there has been the lockdown. But of course, now maybe there will be restarting of work and mothers will start going back to work. And therefore, no baby should be kept devoid of the mother's milk just because she has to go to work. Many a times there are places, institutes where if we give a letter saying that it's better if the mother's leave is slightly prolonged so that the mother can stay with the baby a little longer. There has been times where they have been given that much concession and their leave has been extended. However, some places are a little more strict. So what we do is, if the mother has to join back work, I always tell them that just before you leave from work and immediately after you come back from work, make sure you breastfeed your baby. What to do in between? So, in between, the mother can express her milk in a clean, sterile bottle and keep it at room temperature. It can be kept for around 6 hours at room temperature. Whenever the baby needs, like we discussed, on demand breastfeeding. So, same way on demand, this mother's milk, which has been expressed and kept, can be fed to the baby at that time and whenever required, mostly every 2 hours. Only the reason why, if the mother is unable to express or if her breast milk is inadequate, only then we shift to top feed. That is the powdered milk, which is preferably to be avoided. But if situation is such that the mother's breast milk is not enough, then the top feed can be given. But if she manages to feed before going and feed after coming back, most often this issue will not be required because mother will not be working more than 5 to 6 hours. And therefore, this can be tackled very easily. What she can do is, about a week before she actually starts going to work, she can behave as though she is actually not there in that time when she will be in the office,
Okay.
even if she is at home, and train the other people at home to take care of the baby by giving express milk to the baby at that time. So if she does that for a week or so, even the people at home are more comfortable looking after the baby, and then things will be sorted.
Definitely. Just a quick question here: how long the milk can be refrigerated, or should it be kept at normal temperature? Is it safe to use?
So the breast milk, express breast milk, can be kept at up to 6 hours at room temperature. Every time before giving it to the baby, it's a good idea to shake the bottle. There'll be a little bit of yellow supernatant, which doesn't mean that the milk is spoiled. If there is any form of curdled milk, then that is the spoiled milk, and that should not be given. If the mother is able to express a good amount of milk, then she can put it in the refrigerator, not freeze, but put it in the refrigerator for even up to 12 hours. Now, the important point here to remember is that all these bottles, or whichever part which is going to come in contact with the baby, has to be sterilized. That means it has to be kept in boiling water. It has to be kept in boiling water for at least 15 minutes, at least once a day. It can be even the nipple of the bottle, the top of the bottle, and the bottle itself has to be sterilized. This is so that no form of infection reaches the baby through the bottle.
And a very common question many patients might have been asking you before also, like if they have COVID symptoms or if they have been affected with COVID, how safe is it? However, WHO straight has, given clear instructions and guidelines that even COVID infected mothers can breastfeed their babies. But I think they definitely need a pediatrician's, our doctor's advice here.
So it's not just mine, but the Indian Academy of Pediatrics also endorses this. So does the WHO and the American Academy of Pediatrics, that breastfeeding can be continued even if the mother is COVID positive. So in fact, that breast milk is going to be advantageous. It is going to transmit the antibodies which protect the baby, not the virus.
Okay.
And therefore, the baby is, in fact, is getting protected by giving breast milk, even for newborns who are born out of a mother who is COVID positive. Even for them, we encourage breastfeeding. The mother can continue feeding just like she would in any other case, but only thing is she has to maintain all the precautions of hand hygiene, hand washing, sanitizing, and just before, during the duration of breastfeeding, she has to make sure she's wearing a mask. After the feeding is over, she can stay a little bit away from the baby. Next time when the baby wakes up and demands feed, The same hand washing, hand sanitizing, wearing a mask, and taking the baby and breastfeeding should be followed. Now, even in Indian Academy of Pediatrics, one healthy person from home is allowed to stay with the mother who has just delivered a newborn baby who is COVID positive. Even that person should be following hand hygiene practices, wearing a mask, sanitizing the hands, and taking care of the baby. So even that person who can mostly be the mother's mother can help the mother with breastfeeding, even if she is COVID positive. Now,
Definitely.
the only reason why she may not is only if she is very sick and unable to get enough breast milk. But there is no other reason why she should stop breastfeeding. And as we know, most of the mothers are asymptomatic. They are COVID positive because the test has been done, we came to know. And therefore, they'll be absolutely healthy and absolutely okay to feed the baby. Even if they have fever, they can still breastfeed the baby. Certain medicines which are used for COVID treatment are not allowed in breastfeeding. So these mothers should talk to their doctors and ask them if they are on those medicines, then till the duration those medicines are going on, they can discontinue breastfeeding and then restart once the medicine gets over.
Dr. Ati, just a last quick question there that like breastfeeding has been like it has can help mothers return to their pre-baby weight, and it has been told by all our grandmothers also that if you're going to breastfeed the baby, definitely you'll be able to get back into the shape because it takes around 1,000 calories a day on an average to produce breast milk, and women are advised to consume an extra 500 calories a day, and the body dips into its reserves. It builds up in pregnancy, which has to make the rest. So it actually helps the body gets into the shape back. What is your take on that?
Absolutely true. And Dr. Smita, I have to say, it's not just the mother's weight going down, but there have been a teen number of studies suggesting that even for in general maintenance of a good hormonal balance for the mother, for her mental well-being, as well as long term for protecting her from breast cancer, breastfeeding has been shown to be beneficial. It improves the bond between the mother and the baby. So there are not only physical but even mental and even long-term benefits of breastfeeding. So weight loss is of course one of them, but there are so many other advantages not only to the baby but to the mother also. And that's why encouraging breastfeeding becomes so important.
Surely. So, as World Breastfeeding Week is being celebrated between 1st to 7th of August, and this year, like 2021, the theme is Protect Breastfeeding, a shared responsibility. That means that it is just not the mother's responsibility to feed the baby, but also the entire family should be sharing the responsibility and making sure that the baby is getting adequate milk, especially breast milk, so that the babies are much more stronger, and the next Indian generation is very much healthy and also safe from all different kinds of diseases. Thank you so much, Dr. Aditi Shah, for joining us today for this World Breastfeeding Week event, which is being organized by Medicircle. Thank you for your time, and we wish you all the best for your future endeavors.
I should thank you for encouraging mothers to breastfeed. It's a very good thing. Thank you.
Thank you.